Good afternoon, amazing Vermont school nurses. Here we are at our first town hall for 2021. Hard to believe we've been living with this pandemic for almost 12 full months. I want to start out by acknowledging I admire all of the work that you have all been doing in your health offices, in your school districts, and in your communities. I'm especially proud to be a part of this group of school nurses as we've grown together and supported each other through the challenges, first with remotely working, getting our seats at the table to make decisions to bring students and staff back into the schools in a healthy and safe way. Acknowledge that we as nurses are so much better together as we learn from each other. Before we move into this afternoon's speakers, I want to invite you to the VSSNA board meeting scheduled Saturday morning at 9 o'clock. It will be a Zoom meeting. If you'd like to attend, please shoot me an email and we'll get a link to you. That's where all the nitty-gritty work of our organization takes place. And that's where the boots hit the ground. So we'd be very appreciative to have you join us as we make plans for the future. A couple of announcements as well. The guest speakers that have agreed to speak with us today, like all of you, have been living in various aspects of, oh my gosh, we have a positive case of COVID. The person was positive during the time they were in school. So the folks that are going to share some information with us today are we've asked them simply to share some experiences and the highs and lows, what they've learned and how things have changed for them with the ongoing outbreaks. And I'm very appreciative of their willingness to do that. Please keep your mics muted during the conversations and put any questions that you might have in the chat box. We'll get to those at the end of the conversation. And as we move forward, I want to remind you of a couple of things. One is Clayton's going to put a link in the chat box for all of you. The question of who gets vaccinated keeps coming up over and over. Many COVID coordinators have had to address that in one way or another. And that is a decision that has been made outside of our purview. So Dr. Levine has very clearly outlined who is getting vaccinated next after phase 1A and the rationale behind that. So there's a link to a VPR article that cites his words as well. So I'm going to encourage you to follow up on that and give that information to the people that ask you about the vaccines. Also want to, as we move into this presentation with our panelists, remind you that we use the term contact tracing. The media uses it a little bit differently than we do. I really want to speak to contact tracing. What we as school nurses and COVID coordinators are doing is a part of the whole process of responding to a positive case. And we are not doing all of the contact tracing. We are making lots of phone calls, but that's a small piece of what's going on. So we are very important cogs in that whole wheel process of addressing a positive case of COVID in our schools. Again, questions into the chat box, please. We are going to hear first from Kelly Landwehr, who is the COVID coordinator in Addison Central. We also are going to hear from Becca McCrae at Burlington School District. And I think we may have some others.
Liz Paris.
Kelly, why don't we go ahead and start with you? Thank you.
Hi, I was just introducing Liz Paris from Winooski as well.
Okay, great. Thanks. Sorry, Liz.
And I'm here too from Winooski.
Yay!
Sorry, I couldn't see your face
Hi,
on my
baby.
little screen. And there's Catherine Monk.
Terrific. Why don't we start with Kelly? Kelly, give us a little bit of background and share a little bit, and then we'll switch to some of the others, and then we'll address some questions. Thanks
Sounds
so much.
good. So I'm Kelly Landwehr. I am a school nurse at Middlebury High School and the COVID coordinator in the Addison Central School District. And I appreciate all of you being here and all the good work everyone's doing. I want to echo Soph. I know it's been a rough year for all of us, and we're making it though day by day. So I was going to share kind of the story of our first case that we had and how that played out, and just some lessons learned, just some pieces of info, and then how we're communicating cases. I apologize if it's redundant or things you already know or things people are already doing, but I think we all do things a little differently. So hopefully you get some useful info out of it. Our first positive case was in one of our elementary schools, and it was in a kindergarten classroom. And of course, that first case is devastating for everybody. We all hope it will never come, and of course it comes. And what was interesting about this case is, like most of our cases, the first individual that we determined was positive caught COVID out in the community. It wasn't something that was spread within the school, but we ultimately ended up having 6 cases in that kindergarten classroom. So we did have in-school transmission that resulted from it. And so not only was that first case devastating, but we really were taken aback when we had so many resulting cases. And, we just continued to plug along and do what we needed to do. And the one good thing was that the first case, of course, was contagious while at school. So we had to do tracing within the school and sort all of that out. Everyone was home quarantining the subsequent cases. Of course, people were home, so they were not considered contagious at school. So it was really that one case that we had to determine who were close contacts in school. But just by virtue of the fact that we ended up with 6 cases, we were really devastated, and it seemed like so many cases to come from that. But what was interesting is I asked for a meeting with our local health department folks, Jeff Heath and Christina Dean, who's our school liaison, just to process all of it and see what we could be doing different, why so many cases, are there things we needed to be looking at? So we kind of came into this meeting feeling very defeated, like we had done something wrong. And it was interesting because when we met with them, they're like, absolutely not, you've done everything right. And it was very eye-opening because, like they said to us, you're dealing with a school with over 400 kids, and these cases were isolated to this one pod. They said, so everything worked. Everything you're doing worked. Yes, you had multiple cases, but it's a kindergarten classroom. These kids are not, physically distancing. We know that. And it's just the nature of the beast. But in this big school, you contained this to this one classroom. So everything you've put in place worked. And that was just so nice to hear after feeling so defeated by our first experience with a positive case. So I just wanted to share that story because I think every case is stressful and exhausting and defeating, but to come out of it with that silver lining that, we actually were doing everything right. And there's just stuff that's out of our control. And so not, we don't want that many cases, but it was what it was, and we kept contained. So that was good. I mean, it could have easily blown through a school that size. So that was our first case experience. Just some things along the way. In our district, we've had 24 cases so far. Actually, 20 of them have been cases that the individual was not contagious while at school. So I'm really thankful for that. So we've actually only had 4 cases that were contagious at school. And just some things we've learned along the way. Determining close contacts at elementary schools versus secondary schools, middle and high school, I've learned looks very different because of course in our elementary schools, we've got our kids in their pods. And I've found that contact tracing logs were much more crucial in tracing in the elementary schools versus middle and high school. They were still important in middle and high school, but just seemed to be a little more useful in the elementary schools. In the elementary schools, if you haven't had an elementary case, and this was new to me on that first case, the way it works is students and staff, if they're in a room together for 4 hours or more a day, they are automatically considered a close contact. So that was news to me when we processed that first case. And so in a way it simplifies things, but of course it gives you end up with probably several more close contacts than you would if you were looking at the actual definition of a close contact. I found in the high school and middle schools that the most useful piece of determining close contacts was meeting with teams, meeting with all of the teachers. If it was a student involved, meeting with all of the teachers, all of the people that encounter that student during the day, and really looking at the reality of what the classroom looks like. You know, these are the things that contact tracing logs don't capture. So, you know, talking to the science teacher, did you have small groups on this day that maybe that's not things you're necessarily documenting, but it's really important to sit down, interview teachers, interview people, and talk about those things. And then the other piece that I hadn't thought about initially when we started to have cases was actually talking to the kid that's affected. So middle and high schoolers that have been positive, I'm actually interviewing them and saying, can you think of friends or people that, and that's been also really useful in determining potential close contacts. Again, those are what that has helped with is capturing those situations where maybe it's someone you walk down the hall with every single time between classes, and we just don't know that. You know, teachers, nurses, we're not capturing that information. We're not observing that. But then a student may say, oh yeah, you know, I walk down the hall with this person 6 times a day for 3 minutes at a time, and we're not within, you know, we're within 6 feet. We walk right next to each other. So boom, that kid's a close contact. So that's proved to be really helpful to actually interview the student themselves. And then just communication. And I think different folks do things differently. We really kind of threw around different ideas on how we wanted to communicate cases. Once we started, the way we ended up evolving was our very first case, our superintendent notified the entire district. We've got our first case. Again, we were hoping it wouldn't come, but here it is. And this is what we've done. You know, we're working with the health department and nurses and administrators and just let people know what was going on. And in that notification, the superintendent shared with people that future cases you will hear from your school, and just the school community would be notified. So we decided that after our first case, principals would notify just the school community about that case. We didn't want to notify the entire district via the superintendent for every single case after that. So that was shared in that communication. And then the superintendent shared that people could go to our COVID dashboard and they could find all of those notifications, what numbers were looking like. So no one's being kept in the dark, but we didn't want to kind of set this precedent of having to share every case with the entire district. We wanted transparency, but we didn't want to overload people. And that seems to have worked out well. So for subsequent cases, the principal is notifying the entire school community, staff and families of the positive case. And then we're putting the numbers up on the dashboard, and whatever email the principal sends home, we're also posting that on our dashboard. So of course, everyone has access to that information. So it's all clear and it's there and it's transparent. Our other piece we had to ponder was, do we want to share every case, including cases that are not contagious at school? And again, we just decided that we wanted to share as much information as we could. So we share with the school community all cases, whether they're contagious at school or not. We notify families and staff of those. So that's what I have to share for now. I'll pass it along to Becca next.
Hi, everybody. So to echo what Kelly said, it's every case is different, and you learn something new every time this happens. I'm currently in the middle of a case, just so you all know. We in the Burlington School District are at number 31 today. I have to give a lot of kudos and thanks to my fellow school nurses who have helped me learn about contact tracing before I even had a case. I want to give a huge shout out to Dory in Milton. She gave me the idea of a contact tracing on a Google Drive. So I'm just going to highlight for you guys what has worked really well for me. And as we've gone through all these cases, how I have grown a toolbox to use each time we have a case. So what we did in Burlington was we set up a Google Drive of a folder for each school that was shared with the school nurse and the principal. The folder then contains other folders for each pod, each classroom, that the teacher populates a seating chart in, so that we can have that for contact tracing purposes. And if there's someone like a special ed teacher or a reading teacher or an EL teacher that would have small groups or a schedule between different pods, we ask them to give us their schedule of what groups they work with, what are those kids' names that they work with, how long their classes are, so that we have that to kind of have at our fingertips when we're contact tracing. As stated in our previous town halls, you don't always get the phone call when you're in school. You mostly get the phone call when you're not at school. And so this Google Drive system really allowed us to have access to the contact tracing information without having to drive into school to get our hands on actual paper contact tracing sheets. We do have contact tracing sheets in our schools on each classroom doorway that people sign into. Our school nurses collect those and then scan them into the computer and upload them into a folder within their folder each week, dating them with whatever date they collected them, so that we have our access to those whenever we need them. I'm going to reiterate what has been said in a past town hall meeting, but I think it's super important. If you have not yet had a case, get a template of a line list and populate it with as much staff information as you can, with as much, if you had a tab for each pod, for each of your schools, with as much student information. The more you do ahead of time, the more information that you can gather quickly to just copy and paste into an active line list saves you an enormous amount of time. I was lucky that my first case was in my own school in my district, and I was unlucky that I didn't have any of this set up. And my principal and I spent about 3.5 hours in our first case just on populating the items in the line list. That was before and after all the other process. That was just the line list time. I am really fortunate in that I have an awesome IT person who created a report that she can pull data from a whole homeroom at once with all the line list material, and she just emails me a Google sheet of all that information for that specific pod that we're working the case, and we just copy and paste that into the line list. So anything that you can do ahead of time to help yourself populate that line list in a timely manner will overall shorten the whole time you spend on a case. I personally find the most challenging part, and possibly it's because I haven't done it a whole lot, but the most challenging cases for me are the ones that we get in the middle of the day where the positive kid is still in school. We have to isolate that positive kid, but then we have to figure out who else we have to send home until contact tracing is over, and how to do that smoothly and how to do it so that parents don't freak out, I think is the best. You just really try to think about that with your school district leadership and how that can look. For us here, we do a robocall to the robocall to the parents that says we're in the preliminary stages of contact tracing a positive person in our learning community. Please come pick up your child immediately. We will send further information to you later in the day. When you arrive, please call, and then we give them like the office number so that when they arrive and call, we have the students stay in their classroom with their teacher, and then when the parent calls, we radio up and say so-and-so's, and we just say their name, and then the person that has the radio up at the classroom will walk the child to the door. So we're trying to make it personable. We're trying to help facilitate safety, and I think that's the hardest part for me right now is the when it's in school, and you're just trying to do things quickly in a timely manner. And there's always room for improvement. So I think on every one of these cases, I've been like, next time we should do this, or next time we should do that. And I have to remind myself of this as well, but write that down in the moment because I think about it and then I don't do it the next time because I forgot to write it down. So those are my tips and tricks. I think that I do have a template that I created. Like we created a script for interviewing people. We created a script for the quarantining conversation that you would have when you call the parents of the people on the close contact list. So I do not mind sharing that script with anyone who wants it. I'm happy to do that. But I think that any tools and tricks that we can all share with each other. Like I said, I wouldn't be at the stage I'm at now without my colleagues who have shared their ideas with me. So without further ado, I'm going to pass it to Liz and Catherine, who have a lot of more experience than I do.
Hi, everybody.
I'm going to interrupt you guys just for a few minutes because we have a couple of questions for the two that just spoke. Kelly, one of the questions in the chat box, you had mentioned updating the school district website or dashboard. The question is, who is responsible for that? Is that something COVID coordinator does or someone else in your district?
Yeah, I think this is probably going to look different in different districts. We have a community liaison who is one of our central office staff, and that particular person works with community outreach, connecting the community to schools, working with families who are homeless, things like that. And she, over the summer, she became the chair of our communication team for COVID. And so that has evolved into her being the keeper of the dashboard. So, and she does an amazing job. And what we try to do is coordinate as soon as a principal is going to send out communication, they also share that with her because she is really cognizant of wanting to keep that dashboard updated as soon as communication goes out. So everything's done at the same time. So she does a great job.
That's terrific. Thank you for that. I also want to address, there's a comment about the contact tracing. You may not have been on the call in the very beginning. Contact tracing is initiated with the Department of Health when they hear of a positive case. If that person was positive in school, that's when the COVID coordinators continue on with the contact of those folks that are directly related to the school. And as you know, those of you that have been delving into this whole process, it is a process and it takes all of us, but it usually is initiated with the Department of Health. And then if the person was positive during the school day or during the school time, that's when the continuing contact with potentially exposed people, or for, as you had discussed, who you might have been in contact with in the school itself, that's where the COVID coordinator comes in. And just a little reminder, Becca, people are very appreciative of your sharing that, pre-populating that line list. Then we can just remove the kids that weren't there that day, if that's the case. And a question, why would someone be in school if they were waiting on a test result? That's for you,
Good
Becca.
question. I think that, honestly, I think parents are confused. I really do. I think that some parents go to their primary care for testing or symptoms, and some parents end up in the ED for testing and symptoms. And when they don't hear right away from them, I think that they say, oh, I haven't heard from them, it must be negative. I think that there's a lot of confusion, even though there's been a ton of education publicly and school-based education around you have to test and then quarantine until you get your test results. I don't think every parent 100% of the time is hearing everything that we're educating. And so honestly, it's human error. And unfortunately, we have to then act accordingly based on human error. But I try to give a little bit of forgiveness and a little bit of grace instead of being like, oh, that parent, like they're dealing with a whole lot too. And we have to remind ourselves that parents don't always have the best life. Like they're working 3 jobs and they're single parent and trying to take care of their kids. And so we just have to be forgiving, and we have to deal with things as they come at us. I'd like to save the rest of the questions because I do think Liz and Catherine have a lot to share from their experiences. I certainly valued what they shared with me, so I'd like them to share it with the rest of you.
Thanks so much, Liz and Catherine. We do appreciate your willingness to be here. And many of us are glad we're not in your shoes, so we're eager to learn from you.
Well, let me just start off by saying that it's a really good thing I like my work wife, because I have spent a lot of time with her in the past few months, probably more so than I have my family, with how much COVID is in our district. So to date, we have had 76 positive cases, and we have had to create 14 line lists. And as has been mentioned before, that usually happens in the evenings and on the weekends. Occasionally, we'll find out, if we're lucky, around 1 or 2 on a school day. But our district is currently remote and will be for a few more days. So we have had the blessing of being able to kind of just take a break and focus strictly on just all of the updating and case management that comes along with positive COVID cases. I'll just share a few things, and then Catherine, pipe in with whatever else you want to add. In our district, we are, for those of you that don't know, we are pre-K through 12 under one roof, and we share communal spaces. So for communication purposes, we were originally telling every time we got a case, we were like calling and telling the district a member of our learning community has tested positive. We quickly realized, as the numbers were starting to increase rapidly, that it probably wasn't in our best interest to overload the family. So we went down to once a week communication. So every Thursday afternoon, our communication director sends out an update with how many cases have impacted our school, how many line lists have been created, and kind of just shares it out generally along with the other announcements. When doing the contact tracing list, and you're going back and you're creating these line lists and you're starting to call families and your colleagues, one question that kept repeatedly coming up was, well, if this happened 5 days ago, why am I just being notified now? And having to really explain to them the whole process over and over, that we talked about it and we decided it would be beneficial if we did a district-wide Zoom to explain the whole contact tracing process to all of our staff. So the high school co-principal and Catherine and I created a slideshow that really outlined step by step from the time the person was symptomatic and left school, or the time that, the person was asymptomatic and went to a pop-up and found out that they were positive, and then every step thereafter and what that looks like. And just slide by slide, slowly, calmly, factually went through every single step of the behind the scenes contact tracing, all the way up to us giving them the phone call to let them know that they were deemed a close contact and what to do next. And it was pretty amazing. Like, you could see people, their anxiety just started to go down. I received a lot of emails, a lot of calls and texts afterwards, just really thanking us for taking the time to explain so thoroughly and what exactly happens, because of the fact that they don't know. They just don't know. And you have to think about the fact that they are not medical people. These are teachers. These are people that don't have a lot of medical knowledge. And so when they get a phone call that they have been exposed and you are unable to tell them exactly who, they start to panic. And then their mind becomes a little bit foggy as to where they've been, or they can't find their notebook with their notes. And so just being able to really walk them through those steps and just explain to them how important signing in and signing out on every sheet is, the importance. Catherine tells them this all the time: keep a personal journal, keep it with you, document every single step you take within the building. And then you'll have it for whenever you do get that call. And it's amazing, those people that have listened to her, they have all that information ready to go, and other ones are like scrambling and really trying to think about it. So I would encourage you to really, we like Becca, we do the Google Docs where we have the sign in, sign outs. We take pictures, we send them, and we have them in a folder, so that way we can access them at home as well. But I would encourage you to make sure your staff is really signing in, signing out, that their names are legible. Do you know how many people in this district have the last name that begins with the letter B? Like, a lot. And when they're on the sign out sheet putting just a B, like, that's like 30 people. So we had to go back and explain, no. We need your full name, first, last, printed. Sign in, sign out. That's really important. I know it's going to take a couple of extra minutes, but it's super, super important that you sign in and you sign out. So just like little details like that along the way have been really beneficial to our district. And I just, I know I cannot imagine having to do this without Catherine. We're kind of hip to hip through these processes, and it's just been such a blessing to have somebody that I completely trust to be able to work alongside of and to go through this chaotic mess with. So you have anything else, Catherine?
Thanks, Liz, for those nice words. I have a couple of thoughts, so first, any employee who's considered a close contact, at least at Winooski, and I think probably elsewhere, whoever your human resources officer is needs to know the names of those people, so they can start a workman's comp claim. We learned that after about line list 12. I think as far as, making the phone calls, it's really a partnership with the Vermont Department of Health when you have someone in school while infectious, and we've had 14 community members in school while infectious. So Liz and I, and many of you, it's sort of just the first step in investigation and notification. And in my experience with many of the phone calls, it sort of starts off, the person is angry, they're asking a million questions, they want to know who it is and where it was. And like Liz said, why didn't we find this out 5 days ago? And then as the phone call progresses and you speak calmly and ask them if they have a piece of paper and a pencil and explain to them what happened and what their next action steps are, what they do have control over, then they start to calm down a little bit. And sometimes there's some tears. And by the end of the call, usually there's a thank you. So that's been the trend, is that people are really angry at first, but usually over the course of the phone call, people are thankful at the end. In Winooski, we have a large population of individuals who are English language learners. So our school liaisons have been a huge piece of the pie as far as the work that we're doing. We couldn't do it without them. And I think that some of the cultural differences have been interesting. And I don't know what your experience is in your districts, but having to explain quarantine to a multi-generational family who is learning English, and that if there's 8 kids and only one of them is a close contact, that's the only person who needs to quarantine. That's been really confusing for families. And I've heard in some districts that siblings of close contacts are asked to quarantine as well. And we've decided not to do that. But I have found to being humble is just really helpful, and listening and validating and saying, yep, that makes sense to me. What you're telling me is best for your family. Because some parents choose to keep all of their kids home. Trying to think if there's anything else. I would say just since December 1st, our first case, there's been so much amazing work between the City of Winooski, the Vermont Department of Health, AALV, of course, the school. And it's really been a sort of a team approach, and I've been really honored to be a part of it. I've found that people are willing to listen and answer our questions. And I also learned that in the school, we always hear first, and we always have the information first, and that's okay. And the Vermont Department of Health will vet it and work with us, and making sure that what we have for information and what they have for information matches was really important. So those are my thoughts.
Mm-hmm. And I will just piggyback on that and say about the line lists. And, we do find out the information first. And so we would give the VDH a call and they would say, start the line list and we'll go from there. Well, we work on our end to check to make sure this really is a positive or a probable positive. I think that we have been really fortunate that we have been able to call back. We've been able to create the line list and do the investigation, check in with the VDH to basically spit back the information, and in collaboration, deem close contacts. And then Catherine and I were able to follow up and make those calls to the close contacts all in the same day. So so far, knock on wood, but so far, all 14 line lists have been created and completed on the same day. And that really truly shows you the trusting relationship that we do have with the community and with the VDH. So it's been really nice to be able to do that. I think that there are some other districts that I understand may just make the line list, do some of the investigation, and then give it back to the VDH to do the close contact calls. We choose in Winooski to make those calls ourselves. I think we're really protective of our community and our families. And as Catherine had alluded to, we do have English language learners that will pick up the phone a lot faster for one of our Winooski liaisons than they would like a language line person. So just so you know, that's kind of just one other piece of information. And I saw a couple of people in the chat did ask about that Google slide. Clayton, if it's okay, I'll just share a copy with you or email a copy of that, and then you can disperse it. Okay. I'll take care of that tomorrow.
Catherine, I'm wondering if you could share with us, you mentioned the school liaison, and I know that that is different from the Vermont Department of Health school liaison. So would you share with our listeners what that person's role is, what they do, and how you interact with them, please?
Okay, so our Winooski School District school liaisons are our people we could not do our jobs without. They are our interpreters. They help with case management, not because it's in their job description, but because they are an integral part of our school and are also very respected and trusted in our communities. And so a large portion of our positive cases have been English language learning families. And so Liz and I get on the phone with these homeschool liaisons or Winooski liaisons and explain that their child is a close contact, or ask about someone in the family tested positive and how are the other people in the family feeling, and sort of triaging who else is having symptoms, who else needs to be tested, who else might be a probable positive, who needs help with food or rent. And so they are sort of at the center of all of the work that we do. We also do have a language line, and people do respond to that as too, but certainly not as much as the trusted employees from the district.
Thank you very much for that. Becca, you wanted to address human resources.
I wanted
employees.
to follow up with some lessons learned from what Catherine was talking about in terms of human resources. And our human resources people were really asking me to share line lists with them to know which staff needed to quarantine. And when I talked to my Vermont Department of Health school liaisons who were working cases with me, they actually recommended that we not share line lists with HR. And the reasoning is because not every staff member who needs to quarantine will be on a line list. So if a staff member, for example, gets a phone call from the Vermont Department of Health that they need to quarantine because their brother-in-law was a close contact who tested positive, for example, what they recommended instead of us just sharing line lists was to make sure our district had a very clear system by which an employee who is told they need to quarantine for any reason calls the HR people directly, or they call their supervisor who then tells HR. But it really was more about, don't just share the line list because that's just to that one case. Really make sure your school district has a good system in place where any employee who's told they need to quarantine for any reason has a direct route that message gets to HR eventually. So like whether it's directly the employee calling HR, or whether it's the employee calling their supervisor who then calls the principal, and then the principal calls HR. But you need to have some sort of system that works for your school district. So in our school district, we decided that the principals, because the principals are primarily involved in every case that we're working with the Vermont Department of Health, so they would know who was on the line list. But we also have other people call out for other reasons. And so the principal was made the most sense to be the person to contact HR with names of employees who needed quarantine. The other thing I just wanted to comment on, what Catherine said is true, that there is funding that goes along with this that HR has to apply for. I do know that the laws for the HR funding and all of that changed on 12/31. It's now different. So just check in with your HR people about what the laws are now. I don't even really know what they are. I just know they changed. So check in with your HR person and say, hey, what do I need to know? And how did the laws change so that I can help you and you can help me? Like, make it a partnership with them for sure. The other thing I just wanted to say was the cultural differences was a huge eye opener. And I think that if you have new American families in your district, you really need to think about the fact that wherever these families came from, they come sometimes with mistrust in government agencies. And when Catherine and Liz are saying they trust our school liaisons, and so it makes more sense for us as the school to call, that's where that stems from. We actually have had a few cases in Burlington where the Vermont Department of Health will contact a family, and then they'll contact us and say, the family doesn't believe us. They want to hear from the school. So you just need to keep that in mind. Like, there's a lot of cultural difference and there's a lot of mistrust in the government. So we are the bridge to that. And I think that similarly to what Catherine and Liz said, I think that in the process of the partnership of the Vermont Department of Health, the city, and the schools, we as school nurses are being recognized as professionals alongside all of these people. And it's definitely a partnership, and it's amazing how much work goes into this in all realms to make this all happen safely for the whole community. That was definitely eye-opening.
I think the only piece is that I want to respond to is there's a difference when someone is considered a close contact to an individual who is infectious while at work in school. And so the HR piece I don't recommend sharing line lists at all. I think that what HR needs to know is whether or not workman's comp claim needs to be triggered. That's one piece. The other piece is Liz and I established a 24/7 COVID hotline. We have a cell phone that we share and pass off every other week. And so that has been an integral part of the system that Becca was alluding to. And the message always is, when we get a call and someone says, I have a headache and a sore throat, or my husband traveled and he's in quarantine and now he has a fever. The message is, call your building administrator and call the HR officer. What happens from there, we don't know anything about. But I think there's a workman's comp piece if they're exposed potentially at school.
Thank you. Kelly, you wanted to speak to communication as well, I believe.
Yeah, I just, listening to everyone, I wanted to share a thought about communication home with families. So we also make the phone calls home to our families. And so we're talking about creating the line lists and then making the calls to families. And one piece I wanted to share, and most people are probably doing this, but just in case, is it's really important to follow up the phone calls with a letter home, some type of written communication, because what happens in a lot of cases, the minute that family hears COVID positive, close contact, some people are going to shut down and not hear another word you say. And, we're talking about dates and when your kid can get tested and how long they quarantine and all of this information. It's a lot for people to take in. And so following up with some type of written communication, I think, is crucial in helping people to understand what happens next and symptoms to look for. Sharon Lee shared a link, a health department link, to some really great resources. That site that she shared has letter templates to send home to families and to staff. There's a family version and a staff version, and those are really awesome. It has kind of a grid, and you can put in all of the important dates, what's day 0, what's day 7 when you get tested, etc. And so I just wanted to share that piece. I think it's important because people do. They hear this info and immediately you kind of go blank. It's like being at the doctor's office and getting bad news. You know, you forget everything else that is said afterwards, and then you have to circle back and say, what did you say? So I think that's just something I wanted to share.
Thank you for that. I would also like to piggyback on that. The letters templates are what we have used in our school district as the script when we're making a phone call to a family member. So they hear it from us over the phone, they get it as an email, they get it as a hard copy. Then they also have phone numbers there if they want to call back. And I think the whole communication piece and working together within our school organization in close contact and connection with our HR and with our school nurse liaisons and the Brevard Department of Health. We're all in this together and we all learn from each other. So I'm really grateful for all of you sharing your experiences. If we haven't been there yet, we know we will be. We've had a lot of links posted in our chat. I'll make sure that those are shared. We'll put those on our website as well. I would like to, we have just about 8 minutes left, and I have Brina on the call with us, and I would love to have her say hi and share anything you might like to share with us, please.
Hi, everyone. I am a little bit just speechless at the extraordinary presentations today. I feel speechless, which those of you who know me know is a very rare occurrence. How far we have come as a state, but most especially in school nurse leadership, and you've heard me talk about this before, we will never back down from this position that you have all ascended to. I mean, you were already all there in my mind. It's just a much more visible manifestation of your greatness. And I have such goosebumps. I'm also so grateful for continuous quality improvement because it's not going to be, it's going to be a while. And all that you're learning from each other is the richness of this field. I also love the tone. I just am so fond of the way the nurses spoke about this today because it's really, you're the person in a building that can keep folks from panicking, and that was described. And even Kelly leading with the observation that cases sneak into schools. And sometimes there's transmission in schools, still a very rare event, but kind of setting it up that it's going to happen rather than sort of a panic when it does is the tone that you've all set so beautifully. And I look forward to doing this more and more and sharing your experiences of what works and how to keep moving forward in 2021. That said, we do have, I see that Sharon Lee's on, which is so great because I've been able to publicly thank her in some of the health department settings, but she officially retired at the end of the year, but I'm so glad she's here. We miss her tremendously already. And then I also have the great fortune of introducing you to Caitlin Kodzis, who is our new state school nurse consultant. So, not an easy feat to post a position higher and find someone as amazing as Caitlin, who is stepping into huge shoes in Sharon Lee Treffery's with her departure. So we have so much more to tell you about Caitlin. We're not going to use your valuable time for a long description of that, but please know that she's a rock star school nurse and public health nurse already, and she's physically in Maryland making her way to the Burlington area. If anyone has real estate available for Caitlin, she's actively seeking a place to live, including, and it needs to have welcome her dog. So your mission, if you choose to accept it. So I'm going to stop there with gratitude. I loved listening, and you're an incredible group of people. Thank you.
Thank you, Brina. Caitlin, welcome. Thanks for turning your camera on. We're so appreciative that you are joining us, and Sharon Lee, we're going to miss you. So I was actually quite excited to see that you were signed up for today. It's been a little over a month, I think, since our last town hall. We have amazing people here in our state, Caitlin, and we are so excited to be able to share school nursing in Vermont with you. And I know that the folks at the Department of Health are just going to help guide you in Vermont stuff, and the rest of us are going to be open to your wisdom, and just as we are with all of our school nurses. I am constantly in awe of all that you school nurses do, and I am so grateful for those of you who spoke today. Your it just warms my heart to know. I have to tell you, I didn't know that Winooski had dealt with 70 some odd cases since December or whatever it was. That is a huge amount, and you spoke so eloquently, so professionally, like you'd been doing this forever. And that's important for us to be able to absorb. So thank you very much for that. We're going to capture everything in the chat that will be posted. Other things that folks have mentioned will be shared on the website. This presentation has been recorded, and that will be up for those who were unable to attend, or for any of you if you want to review it. As soon as Clayton is able to get it up, he's always posting sooner than I think is going to be there. So after I threw him under the bus once. Want to again thank you all for presenting. Thank you for your great questions. Next week, we will be having a town hall. Dr. Erin Maughan, the Director of Research from the National Association of School Nurses, will be speaking to us about data and current practices, research in school nursing. That invitation will go out early next week. Again, if you'd like to join us, we'd love to have you at the board meeting on Saturday morning. Just send an email to president@VSSNA and we'll get a link to you. And for those of you who have received your vaccine for COVID or will be getting your vaccine, if you would like to and would agree to have your picture posted, we would love to have you take a picture. We'll post it on our Facebook page, #FollowTheLeader. We are sharing we're sharing that we are vaccinating for our families, our schools, our communities, and the faith that we have in the science that will help us end the devastation of the pandemic a little bit sooner by doing that. So that can be sent to our COVID-19 email as well. Again, thank you all very, very much. You are amazing. And I hope that we will see as many of you Saturday morning as we've had here this afternoon. Thank you. Get some rest.